We are the proud educators of Kindercastle. We welcome you all for this session of Child Development Program, which is organized by Chris Mind with collaboration with Kindercastle International. Talking about Kindercastle, it is a true journey of a passionate educators who were willing to start to uplift the education in such a level that the preschool learners get to know about the learning in a playway method. And with preschool we even have a daycare and a activity center under one roof. So it starts in the morning and we end up at the evening hours. When it comes to preschool, as I said, it's a playway method of learning where we try to nurture the kids in the best way, and we try to build up their upcoming future in such a way that learn and they develop the curiosity of learning from their preschool learning level only. That they have pairing with the friends, then they have like collaboration with their group members working together. So we have even activities which have been planned earlier for the entire daycare kids in the weekdays. So we have number of activities where it is connected with the celebrations also, games also, and their task also, where they have to complete their monthly task, having dance sessions, having right brain activities at our premises. So number of activities we are conducting in the evening hours. So you'll find that the kids are engaged in.
The today's topic is the developmental delays in early childhood, how to identify early signs. So early childhood, usually we consider it from birth to 7 years. This is the early childhood. So most of the development happens during this period. All the progress, all the changes at the physiological level, at the psychological level, at the emotional level, cognitive level, which is happening at the time of conception, that starts at the as soon as the child is enters in the mother's womb. This development starts happening, and it's keep on the progression you can see up to their early childhood. The moment when the a woman goes in the labor, from that moment onwards, the child's brain has start interacting with the external environment. Before that, the child was only in the safe, the environment was there. So once the child's brain start interacting with the external stimuli, with the external environment, they start getting the experiences. These experiences can be good or bad or traumatic or whatever. That is a different case. But as soon as their brains start interacting, what they do, they get the experiences. And with those experiences, they start their learning process. And every single day, every single moment, the child is spending time with their parents, with their peers, with their relatives, with their people around them. And that's how they start building their either their language skills, their emotional bonding, or their the cognitive skills as well. What kind of a atmosphere you are giving to your child, that is going to define whether their brain development will happen in which way. What kind of a foundation you are giving, is it strong? If the parenting was absolutely, because yes, there are some cases where the negligence happens, that we also know, where the mother is in such a situation, she is not able to take care of the child, or maybe some other person is available, so in that cases, that strong the bonding between the parents doesn't happen in such cases. First type of development is the neurotypical development, which we also call the normal development among children. And the second type is the atypical development, which we also considered as developmental delay. Six major areas where the major development happen in the first 3 years of life. First is the cognitive, fine motor skills, the gross motor skills, language skills, self-help skills, and social emotional skills. Now these are the milestones which are usually considered as a standard development. This is a typical development. that we should expect in a child from the age of 3 months to 4 years. The child should be able to recognize familiar faces, as I already tell, and give a smile back. If you just go close to the child, to the baby, they will, if you are a mother or if you are a father, they will just look at you and they will give you a smile back. That means the child has started the skill of recognizing. If you do something, like if you are playing with some musical toy, if you are playing with some small toy which makes sound, then they will look at you, they will turn their face and they will look at you. This skill start developing at the age of 3 months. Now once they reaches to the 6 months, the child should be able to sit on the floor or on the sofa with the back support. This skill is usually developed at the age of 6 months. And from between 6 months to 1 year, they start scrolling. Age 1 year to 2 year, they are very excited about the company of other children. They start understanding that what is a peers, what are the peers, the friends. They want to play with others. Okay, they know, okay, not only my mother or father is in my life, I have a society as well. I have other peoples who can accompany me. And they follow simple instructions, recognizes names of familiar peoples. And by the age of 3 years, they can shows affection for their playmates and friends and sort objects by shape and colors and matches objects to pictures. And they can use this pronouns if you, if I, you, me, and sometimes plural too as well. The age of 4 years, which is almost the age of going to school, a proper mainstream school. What happens usually at that age? They can follow 3 steps commands like wash your hands, comb your hairs, and they can draw circles and squares. They can, at least their fine motor skills has developed completely at the age of 4. That is the reason we say, like, at least by 4 and 5 years, not before 4 and 5 years, we should send or force the children to write, because let their fine motor skills, let their finger muscles develop naturally. Some distorted physical appearance are there, and that may be a reason that it might have pass on to the other generation and the child is born in this way. So this is one reason, but we cannot actually control this this condition, because this is just happens. Now the fourth one is the environmental risk. Now the environmental risk is when you are not able to give a proper safe environment for the mother and the child. So I'll give you an example, we have a car. If I have a car and it runs with a petrol, okay, so I go to a gas station and by mistake, instead of putting petrol, I fill my tank with diesel. What will happen? The diesel is CO2. The petrol is the oxygen for my car, which was needed. But instead of that, the car is full with the CO2. This asphyxia is a very dangerous condition, and in many cases I've seen that umbilical cord got stuck. It was stuck at the time of birth and this and that. That is the reason at the time of pregnancy, there are some prenatal yogas are there, exercises are there. We always say, go do the breathing exercises. Breathing exercises. Even at the time of labor, there are some breathing exercises which for professionals are there for them to, who know very well how to take those type of breathing, practices, how to do. So when echolalia cases used to come to me, when I say, for example, the child names was Arjun, for example, then I say, okay, Arjun, do this. The child will immediately repeat, Arjun, do this. Okay. So they will simply copy you. So sometimes we do that, but they will copy you exactly the way you are telling. Then when I say, good job, Arjun, he will repeat, good job, Arjun. Okay. And without any emotions, without any expressions, they will simply copy you. The second is the delayed echolalia. In this case, what happens is the child will catch one phrase, whatever the parents say or whatever the people around them say, they will catch it, they will save it in their brain, and they will tell it some other time. For example, in one case, what happens? A child was did a good job. The child, I was giving them some table activities like some board game activity, and for the first time, the child did something which was according to the it was a target, and he achieved it. Then I say, good job. That time he did not reply anything. Good job, Arjun, I said. And that time he did not reply. Later on, after like half an hour something, he was just moving and say, good job, Arjun. Good job, Arjun. Good job, Arjun. Okay. So this is the echolalia that they will repeat, they will repeat, they will repeat. So if you see that this is happening, that child is repeating in some weird way or something, then please considered it as a some delay sign and see the doctor. And doesn't speak in sentences by 3 years. Obviously, this is also related with this point only, that if the child is unable to respond or make two words, and of course when they are not able to say two words also, they won't be able to speak up in a sentences. The next slide, please. Now the developmental delay sign, the vision. In many children, we have seen that they have vision related difficulty. And what are the consequences of vision related difficulty? That they won't be able to read. And usually, when the parents get, they identify it when they start going to school, preschool also, because the child is unable to see the letters. The child is unable to see the books, unable to read the books, unable to differentiate between what is happening before them. So vision related difficulties, close up vision deficiency. So they have to read like this, literally they have to read like this, and they are a young children. So if you're showing this to them, they cannot see. So these things, when you see that they can't read, they're not able to see the things. And poor hand-eye coordination. Obviously, when their vision is poor, they won't be able to perform the task. They won't be able to do the things. If you ask them to keep this item here, they will keep it somewhere else. Okay? And functionally blind. Functionally blind means when the child needs some aid and support to do certain things. Give a movement to the bone. एंड मूवमेंट, बोन को मूवमेंट ना देने की वजह से वो हमेशा लूज रहते हैं वो पार्ट. कभी आप देखिएगा, अगर ऐसा कोई केस देखा तो आप देखिएगा कि बच्चे का जो डेवलपमेंट है हैंड का, वो थोड़ा अनयूजुअल है, कि हैंड्स थोड़ा डिफरेंट मूवमेंट में है, एंड थोड़ा सा डिस्टॉर्टेड है जो फिजिकल बच्चे का अपीयरेंस है. सो इन दिस कंडीशन दे विल व्हाट हैपेंस, दे विल फ्रीक्वेंटली फॉल. बच्चे गिर जाते हैं, बच्चे स्टैंड नहीं कर पाते, बच्चा चल नहीं पा रहा, 2 कदम चला गिर गया. ओके. एंड बच्चे को जंपिंग में प्रॉब्लम हो रहा है, मतलब कि इवन दो आप सोफा से भी अगर बच्चे को बोलोगे कि जंप, दे वोंट बी एबल टू जंप बिकॉज देयर मसल्स आर नॉट सपोर्टिंग. बच्चा wants to jump, but the muscles are not supporting for them, and the muscles are sending a message to the brain that I can't do it, I cannot do it. So the brain is sending back the message to the child, don't jump. So this is what is happening. It is not the child is rigid. अगर बच्चा, see, always remember, whether you are a teacher or whether you are a parent, अगर बच्चा किसी एक्टिविटी को करने के लिए बार बार रिलेक्टेंट हो रहा है, मना कर रहा है, बच रहा है या चिल्ला रहा है, तो समझ लीजिए कि बच्चा जिद नहीं कर रहा है, कुछ प्रॉब्लम हो रही है बच्चे को. देर इज समथिंग रॉन्ग, जो बच्चा कर ही नहीं पा रहा है. आपने 100 इंस्ट्रक्शंस भी दे दिए, आपने डेमो करके भी बता दिया, बट भी नहीं बच्चा कर पा रहा है, तो दैट मीन्स ये हमारे टो हैं और ये हमारा नी है फॉर एग्जाम्पल. तो बच्चे के जो भी काफ मसल्स है, जो हैमस्ट्रिंग्स हैं, वो इतने वीक हैं, कि बच्चा अपना पैर ही नहीं रख पा रहा है. कंसल्ट अ पीडियाट्रिशियन एंड देन अकॉर्डिंगली, और डेवलपमेंटल जो आपके बोन स्पेशलिस्ट होते हैं उनको दिखाइए, पीडियाट्रिशियन को, नॉट अ जनरल ऑर्थोपेडिशियन, पीडियाट्रिशियन ऑर्थोपेडिशियन, ओके, या excuse me. Now the final is the social and emotional development. Obviously, any aspect, because we all want our child to do a holistic development. हम ये नहीं चाहते कि बच्चा किसी भी चीज में पीछे रहे. As a parent, as a mother, as a teacher, we all want कि we can do best for our child. So this social and emotional aspect is also equally important as physical and cognitive and this and that. So when you see the child is not able to get along with others, when you see the child is unable to express feelings and the ability to communicate needs, जब बच्चा आइसोलेटेड रह रहा है, अपने अपने में रह रहा है, आई कांटेक्ट, whenever we start therapy, first thing to work on the eye contact. Once they develop the eye contact, we can do the other things as well. Now, what are the two common problems under this delay is Down syndrome and LD and ID. LD means language deficiency, language disorder, and ID is the intellectual disorder, where the child is unable to learn new things, process new things, acquire new skills. Intellectual disorder, where the child is unable to adapt new behavior. Eye contact is there, no emotional connection is showing, the child is not connecting, not playing with anybody, no language, everything all together. If it is there, the child has stimming problems, screaming is there, weird voices are, if he or she is making, then reach out to the child psychologist, a clinical psychologist you can reach, or to a psychiatrist. Okay, and so accordingly, so comprehensive evaluation if child shows signs of ASD, it is maybe, it can be any disorder. Please don't do any evaluation at home. Please go to a professional. That's why I am saying the developmental professional you should go, not a regular pediatrician, not a regular orthopedician, because there is a different stream called developmental pediatrician, developmental nutrition, or developmental this and that. They have done their fellowship in absolutely in this area, the developmental delay. They will be able to guide you better, they will be able to give a better evaluation of your child, and that's okay. That's okay. If anything is going, if anything is falling behind, if child is showing some symptom, don't get panic. First of all, don't be in a denial mode. As a professional, I am telling you, the early you accept this situation, the more you can bring. And in the children who have delays, as I already told you, there are some dysfunctioning is happening in the brain. If we don't take action in the first 1,000 days of their life, we don't give them any intervention or any therapy or any treatment, what will happen? This neuron will die forever. Then that skill to, it will be absolutely difficult to teach them that skill. That is the reason when a 1-year-old child or 1.5-year-old child came for the therapy to me, now that child and ASD, and the child was diagnosed with ASD. The child has autism. Now that child is going to a mainstream school because the therapy has been done for like 6 months and for a year, and the child is now fine. Yes, of course, there are some 5-10 percentages are there जिसमें child कहीं ना कहीं lag कर रहा है, but the child has improved a lot. Whereas I have also seen such cases where the child is 6 years old and the parents came very late. आफ्टर 4 years और 5 years, फोर्थ और फिफ्थ ईयर ऑफ द चाइल्ड में बच्चा को डायग्नोस हुआ कि ऐसा ऐसा प्रॉब्लम है, बट उस समय उसका न्यूरोप्लास्टिसिटी इतना डाउन हो चुका था कि हमें भी बहुत डबल एफर्ट डालना पड़ रहा है, बिकॉज दैट फ्लेक्सिबिलिटी इज गॉन. नई चीजों को सीखने का, फिर से रिवायर करने का ब्रेन को, वो टाइम पीरियड चला गया. सो प्लीज, इसीलिए डिनायल से करने से ज्यादा बेटर है, प्लीज अर्ली डायग्नोसिस के लिए जाइए, प्रोफेशनल्स आर अवेलेबल, और ये अवेयरनेस आप जस्ट पास ऑन टू द अदर्स.
Child will take if the child is taking a therapy to come back to the routine or come back to the normal this thing that's what I wanted to understand. I'm sure case to case is a different matter, but what is the general timing or general time we have to give for these things?
Yeah. So, so one thing I will say again, case by case is different because in some cases the child is only having ASD. The child won't be having any physical deficiency or disorder. So that's where usually we take from 6 months to 1 year. It takes because acquiring and teaching new skill will take some time. Yeah, because we have to literally, when we do the treatment, we have to make certain plans, treatment plans, and we have to go with target by target. So, and then we do the evaluation. Okay, this is the therapy done for a month or 2 months, and now what is the progress of the child? Whether the child is able to do it or not. If the child is not able to do, again, that means the child is still not learned. So we have to, keep on working on that. So case by case. Some cases are very complicated where there is no language, the cognitive processes are absolutely impaired. The child is also having a CP or MD, and ASD is also present. Then you can imagine. Then we cannot give a timeline in such cases. It has to be sometimes go for like for a very long time. उनकी पेरेंटिंग कैसी है, घर में कौन कौन हो, कैसा माहौल हो रहा है घर में, ये जानना भी बहुत जरूरी है क्योंकि क्या चीज इसको इंटरप्ट करेगी थेरेपी को, वो जानना आपके लिए जरूरी है एंड उस चीज को हटाना है, उनको समझाना है ये मत करिए, दिस इज नॉट गुड फॉर योर चाइल्ड, है ना? तो ये चीज है।
I have one more question. That when the kids love this, I mean, when can we suggest them for the physical activities like swimming, gymnastics, skating? Can they get involved into these activities, and do these activities help the kid to develop the concentration or focus?
एब्सोल्युटली, यस। आप जितना बच्चों को एक्टिव रखेंगे, सी, until unless they have any physical limitation, there is no stopping factor. They can go for any, they can go for music classes, they can go for swimming, they can go for anything. But also at the same time, अगर बच्चे को इंस्ट्रक्शन समझने में प्रॉब्लम है, अगर ऐसा डायग्नोस हुआ है कि बच्चे को थोड़ा सा प्रॉब्लम हो रहा है एक्सेप्ट करने में नए लोगों को या इंस्ट्रक्शन समझने में, तो प्लीज डू इन्फॉर्म द इंस्ट्रक्टर और प्लीज टॉक टू द स्कूल जहां भी आप भेज रहे हैं कि थोड़ा बच्चे के साथ ऐसा है तो प्लीज टेक केयर ऑफ द चाइल्ड, सो दैट बच्चे को भी एम्बेरसमेंट ना हो बाद में और पेरेंट्स को भी नहीं हो।